Hello, my name is Gina Becker and I'm with Contigo Counseling Services, and I'm here to talk to you about trauma. In my last video, I mentioned that trauma is a deep wound that has not been resolved and causes trouble in adulthood, and we have a sense of feeling stuck in that trauma. Oftentimes, this is a subconscious uh, awareness or unawareness, and consciously you know there's something not right, but but everything else is really within the subconscious level, and therefore all the behaviors are very confusing to most people, and bewildering, and often very scary. Okay, so there are four levels of trauma that I want to talk about, and the first level of dealing with the trauma is and it again is subconscious, but you have maybe a gnawing, okay, or a just a feeling of foreboding, and this can vacillate into level 2, which we'll discuss in just a moment. And the way you deal with that gnawing and that sense of uneasiness is by distracting yourself. You might distract yourself with uh, mental activities like reading, watching television, maybe playing uh, games, video games. There might be some over exercising, some movement, where you maybe have a lot of sex. You might have problems with gambling or drug addiction or uh, overeating. Okay, so these are distractions that you use to try to uh, suppress that gnawing feeling of something's not right. Something, I feel uneasy about this, and I just want to feel normal. And so you might use those distractions. The second level is a little bit more severe, and it is you sometimes have both level 1 and level 2 playing together back and forth, and even level 3. Okay, so in which we'll talk about in just a moment. So level 2 is more of again more of a forebodingness, a heaviness. You may have be dealing with triggers which are uh, little uh, triggers of memory that are being brought on by somebody who might resemble your abuser or has the same characteristics or mannerisms, and you just get triggered, and you're not sure what's happening, because again it's on the subconscious level, but on the conscious level you're feeling your autonomic system uh, uh, feeling of fear, or um, maybe terror, maybe rage. You might have some shaking and trembling. You could probably be feeling feelings of where you're just not feeling right. Okay, and again, you might have those feelings that are tend to like just play on you, and this could be vacillating or at the same occurring at the same time as level 1 and level 3. Okay, so your drug addiction might escalate, your sexual promiscuity might escalate, things like that. Okay, your overworking, might increase. There might be other symptoms like hypervigilance. There could be things like your heart racing, you're sweating, you just don't feel comfortable. Okay, and then there's also an uh, trauma that is on another level and deeper level, and that would be level 3, and that would be something experiencing um, uh, autonomic, your autonomic nervous system reacting in ways where you have uh, panic. You might have sleepiness. You might have heaviness, like a feeling of just a weight. Lots of tension. You might have some nausea. You might have trouble regulating your body temperature. Um, you might have confusion and a sense of hopelessness. Okay, so those tend to become even more uh, concerning because you're just not able to self-regulate. You start to feel uneasy and you feel out of control. Okay, and so you amp up the control, on other things. You're, um, or you indulge more on other things. That's your way of dealing with these things, these negative feelings. Okay, and again, these are all subconscious, so you're not even sure what's happening. You're not able to articulate what is it that you are feeling necessarily, because again, when you experienced the trauma, it was in your 5-year-old state of mind, and you don't always have the words to articulate what happened to you. Or let's say you are trying to figure out, why do I feel so vulnerable, and that feeling goes back to when you can identify it goes back to when you were 5 years old. Okay, so if I'm making uh, connecting dots for you, please tell me more in the comments. Okay, and also click the thumbs up. And if you haven't already, please subscribe. There will be more videos coming in the future that will break down things even more. Okay. The last level of trauma is the most severe. And this would be, again, you can vacillate, or these can all occur together, but in this state you have a sense of numbness. You really are not connecting. You aren't everything looks great on the outside, but on the inside you're just kind of like out of there. You are not in touch. You just seem to be, you seem to be outside of your body, and that would be dissociation. And so you have a uh, sense of, I'm sorry I say a lot, but it's I'm just trying to get this all out and within a certain amount of time. Okay, so you might have a blank stare or affectness. There might be some spaciness. You might lose track of time. Uh, Things like that. Okay. This is trauma that you basically, it overwhelmed you so much that you had to escape. Okay. This would be trauma that you tried to, like, for example, in childhood, maybe you were in foster care. Your parents weren't, they were neglecting you or abusing you, and then you went from there to a foster care home, and they tended to neglect you or mistreat you, and or fail to just to be warm towards you or comfort you in any way. And so these, or maybe even molested you. So these are different things that this would be compound trauma. And again, you suppress them. Maybe you had one parent who excuse me, was physically or sexually abusive, and then the other parent was neglectful or dismissive or mean towards you. Okay, so these are just the different scenarios that would cause that severe trauma. Okay, and that would be dissociation. All right, so I'm going to go ahead and talk about uh, how we have to get in touch with this trauma and in order for us to heal. Okay, and I'll go into depth more in the future videos. So the first thing you have to do is begin to identify, and you cannot do that if you're continuing to numb or dismiss or suppress or ignore or distract yourself from this trauma. Okay, and so I want to encourage you, although it's going to be very difficult, to stay within that moment of that trauma, whatever it is. And in your 5-year-old or 3-year-old self, although you're not able to articulate, just identify what it is that you do remember. Okay, maybe write it down, or and it might just be little, like I said, dots. Okay, I'm 5 years old. We lived in this house. That I remember this. I remember so and so lived there with us, grandma or whatever. Okay, so these are different dots that you're going to connect, and eventually they'll begin to formulate a picture. Maybe not a full picture, and this does take time. You do need to have somebody who you can lean on for support, and who is a good, not just a good listener, but can hear you, does hear you, and maybe they don't have to have answers for you. They just have to be able to hear you, express that pain, relate to that pain, or affirm that you should be in that pain. Now, I want to go ahead and affirm you as well. If you stayed this long, that tells me that you are watching this video. That tells me that you are interested in healing from trauma, and you are wanting things to change. The symptoms that torment or haunt or perpetuate throughout adulthood are debilitating, and nobody needs to live like that, especially because trauma can be resolved. It is very hard work. You will find yourself struggling at times, and I'm available for one-on-one sessions. All you have to do is leave a comment saying I need to connect with you, or I'd like to connect with you. We also have groups that we can go ahead and include you in to address the trauma. And then also we will be having a question and answering session fairly soon. Okay, I hope that you enjoyed the video. Again, please subscribe so that you can get the next video, where we will begin to learn how to tell our story. Okay, and then we will break down what trauma that was experienced, and how did that look, and how did that play out in our behavior and our relationships, and our with others and ourselves. Okay, thank you very much for watching. You have a great day, and join me next time. Okay, thumbs up, please. Bye bye.